Hello, everyone. Good morning, good afternoon, good evening, wherever you're from. Thank you so much for coming to watch my presentation. My name is Akhila. Today, I will be talking about mitigating the risks for Alzheimer's disease. So a little bit about me. I am a rising senior at the Liberal Arts and Science Academy in Austin, Texas. Some of my extracurriculars include Science Olympiad. I'm a co-founder of Higher Orbit Foundation, and I am working on my internship at the Computational Neuroscience Lab in IIT Madras. And my future plans include pursuing the global well-being through neuroscience. So due to increasing life expectancy, aging-related neurodegeneration is a growing global threat. And about 30 to 35 million people worldwide currently suffer from Alzheimer's disease. And this disease also affects the caregivers, families, and extended communities of those suffering from Alzheimer's disease. And my motivation for giving this presentation is that neuroimaging evidence suggests that Alzheimer's disease pathology begins like around 15 years or more earlier than the appearance of clinical symptoms. And it's really heartening that research shows that we can lower the our likelihood of developing Alzheimer's by modulating some of these risks. So the APOE4 allele, which is a genetic variant of the APOE gene, is associated with increased risk for late onset Alzheimer's disease. And also the environment, personality, education, exercise, lifestyle, stress, just for some examples, can also significantly modulate one's risk of developing Alzheimer's disease. So personality has an impact on Alzheimer's disease risk. People who are more open to new experiences, people who have more pro-social extroverted behavior, people who are less conscientious and less neurotic, and more conscientious are less likely to develop Alzheimer's disease. Older adults that have Alzheimer's disease pathology who are less neurotic and more conscientious were cognitively healthy compared to people who had more neuroticism or less conscientiousness. It's a really interesting study. Stress also has an impact on Alzheimer's disease because high levels of chronic stress will result in a constantly activated glucocorticoid receptor. This is a receptor of cortisol, which is a stress hormone in humans. And this has been correlated with neuronal damage in the hippocampus, which promotes degeneration in the brain. Actually, high cortisol levels have been found in patients with Alzheimer's disease in their bodily fluids. And those with genetic mutations that inhibit GR from working as effectively have been found to have a much lower risk of developing Alzheimer's disease compared to those who have working glucocorticoid receptors. Mitigation. We can mitigate our risk of developing Alzheimer's disease through personality. Educational attainment, pursuing education, and opening yourself up to novel experiences has been shown to decrease risk of developing Alzheimer's disease through openness. And practicing loving kindness meditation increases social connectedness, and mindfulness meditation has been shown to decrease neuroticism, which also decreases your risk of developing Alzheimer's disease. Stress alleviation can also impact. Stress alleviation can also be a pathway of mitigation. Engaging in creative outlets or other hobbies has been shown to have a de-stressing effect on people. And also music as a protection against memory loss is really significant, and musicians have a lower risk of memory loss or other like unhealthy sorts of aging compared to non-musicians. And aerobic exercise also has been shown to lower stress levels and at the same time reduce Alzheimer's symptoms. And exercise can also, at the same time as reduce risk of Alzheimer's disease, it can also promote neurogenesis. And exercise releases a lot of hormones like the brain-derived neurotrophic factor known as BDNF that strengthens synaptic connections between the neurons, which promotes memory. And other hormones also release growth factors that can lead to better cognitive function and mood. And also practicing loving kindness meditation in a sustained manner has been shown to positively modulate structure and volume of the amygdala. And so from my research, I've kind of thought of 3 questions that could possibly lead more research on Alzheimer's disease. And the first one is about salience. So can the salience of emotions and experiences offer protection from Alzheimer's disease? Chaos has been linked to openness and learning. So how can we actively promote brain or chaos in the brain signal data in our brain? And also there has been a link between larger amygdalas. This is an indirect link, by the way, between larger amygdalas and a lower risk of developing Alzheimer's disease through the APOE allele, the prosocial behavior, and enhanced autobiographical memory. So is there a more direct link between amygdala structure and Alzheimer's risk? So healing through music. So music-based therapy has been shown to have a therapeutic effect on Alzheimer's disease, as explained earlier. It lowers stress levels. And the emotional response that is strongest with music is with music that the patient enjoyed in their childhood. So with this insight, I am creating an adaptive virtual reality-based music game for Alzheimer's disease patients. This is a collaboration with the Computational Neuroscience Lab in IIT Madras, and this is using C#. And I am also playing in the Red River Ensemble, which is an orchestra formed by the Dell Medical School and the UT Health Austin. And this is to provide musical relief for patients and visitors of the Dell Seton Medical Center. So our key takeaway from this presentation is that due to increasing life expectancy, neurodegenerative diseases like Alzheimer's are a growing global health threat. And it's very important to recognize that we can reduce our risk of developing Alzheimer's as described by this graph. So here are some references. So I have, before I conclude the presentation, I have some acknowledgements to Sundari Elango, Rohan Nadesh, Sandeep Nair, Dr. Srinivasa Chakravarti, and others in the CNS lab at IIT Madras for guiding me through this research study and giving me such a wonderful experience. And thank you so much for watching. If you have any questions, feel free to contact me, and thank you.